Let people join. Thank you, everyone. We are going to give it just a few minutes till we get started so that everyone can come in from the waiting room, and we'll give a couple people some time to join us. We are happy that you're here with us today. How fun is this? I get to do 2 panel discussions today. This one and then here at Groundbreak.
You're just having too much fun today.
I am, right? Get to do fun stuff in my job. All right, we're going to give it 1 more minute, everyone. Thanks for joining us so far. Just so that everybody can come in from the waiting room, and then we'll get started. So thank you for joining us.
Cal, the question always is, have you read every single book that's behind you?
Dana, the truthful answer is no, not every single book. I do skim a large number of books, and I try some speed reading, but some have been gifts, some have been wish list. But yeah, thank you.
Very nice. All right, so we are going to get started. So my name is Sonia Bowman, and I am the Executive Director of the Construction Industry Alliance for Suicide Prevention. Today, we are going to have a conversation about mental health and substance use and misuse, as well as the intersection between those topics. As always, just know that we will talk about both of these in some great detail. We will do that safely and compassionately, but know that sometimes this topic is hard to have and hard to listen to. And if at any point you are uncomfortable with that, please feel free to tap out. It will be recorded, and you can then go back and get the resources that you need afterwards. Thank you to my amazing panel. I am so excited to have this conversation with all of you. I am honored today to know all of you and to be able to share all of your knowledge with our listeners today. So I have Dana Piscopo with me, Nick Williams, and Cal Beyer. So I'm going to have you all kick off and do a little bit of an introduction, please. Dana, why don't you start us off, please?
Sure. Thanks, Sonia. Hi, everybody. Again, my name is Dana Piscopo, and I am a director for go-to-market planning at Oracle Corporation. I've been with Oracle for about 22 years and have been through a lot of changes with Oracle over the years. But the best thing that I've got going right now in the past 5 years, besides my sobriety and my recovery, is running a couple of programs at Oracle, Reclaim Your Moxie and Oracle Alliance for Recovery. I'm also the co-chair of the Corporate Council for the Recovery Friendly Workplace Institute, and just love being in this space and being part of something that's bigger than myself.
Amazing. Thanks for being here today. Nick?
Yeah, I'm Nick. I'm the CEO of the Subcontractors Association of Colorado. We're one of 34 national chapters of a national association that helps take care of subcontractors. And by take care of subcontractors, what that means to me is top to bottom, inside and out, really just meeting our workforce where they're at and trying to do everything we can to help them have fruitful and long lives. So yeah, my personal vision is to enhance and save lives, and the work that I do allows me to do that in a few different ways. So I'm happy to talk about the topics today.
Very cool. Thank you. And last but not least, Cal.
Hey, Sonia, thank you for having me and allowing me to join Nick and Dana. I'm Cal Beyer. I'm the Senior Director of Safe Workplaces for national nonprofit SAFE Project. That stands for Stop the Addiction Fatality Epidemic. I've been a career safety and risk management professional. I transitioned to SAFE Project about 18 months ago. I previously partnered with them for about 2.5 years and really wanted to focus the remaining years of my career on this intersection between substance use, mental health, and suicide and overdose prevention. So honored to be here with our great panelists.
Thank you all for being here with us today. I am honored to know each of you and to have this conversation with you. For those of you that are listening today, if you have questions, please put them in the Q&A. We will share some time at the end to be able to answer those. So talking about why we're doing this right now, Suicide Prevention Month and Recovery Month are the same, which is September. But because we know that each of them needed to have their own spotlight and time to have real and authentic conversations about both, we punted as the Construction Industry Alliance for Suicide Prevention this conversation to October, which is why we're here and why we're having these conversations now. So I'd like to kick off the conversation, so to speak, with Cal. And can you just start by sharing a little bit about the intersection between mental health and substance use or misuse and suicide prevention?
Yeah, Sonia, I think this is really important. We've done a lot in our industry to promote suicide prevention. We were more comfortable talking about suicide prevention than we were about mental health. And we're still more comfortable talking about those than we are substance use. It's been easier for us to talk about overdose prevention than it has been about substance use prevention. So I love how you introduced this. September is both suicide prevention and recovery month. We've done so much to promote suicide prevention that a quick impromptu 200 social media panel showed 99 to 1% in favor of suicide prevention, 1 to recovery. What I hope will happen going forward is we'll take a balanced approach and to recognize, because of this intersection between suicide and substance use and mental health, we need to balance recovery and we need to balance substance use. What's important to me is there is data that shows persons with alcohol use disorder and opioid use disorder die by a higher rate of suicide. We don't focus on those numbers because we don't want to create shock and awe. But I think for today, just recognize that that intersection is real. And persons with substance use disorder are people who frequently are isolated from care. We have drug-free workplace policies. We do drug testing protocols in much of our industry. And if it's only punitive-based and it's not human-based, and it's not focused on teaching people how to access care, it's hard for people to disclose that they need help for themselves or for a family. It's also important to recognize that that lack of empathy, that lack of concern, frequently comes from a zero tolerance approach. And our industry has had that historically. So this idea is moving upstream to identify root causes and to be sensitive that the root cause of failing to receive help for substance use frequently comes from stigma and then consequences that can be harsh, including loss of job. So we need to be more holistic in our approach to suicide prevention, to be more respectful, more mindful, and then really approach this from a recovery-friendly standpoint. That would be a quick overview.
Okay, thank you. I appreciate that. So we obviously chose each of you to be on this panel because you bring something really unique and important to this conversation. And as I had personal conversations with each of you, one of the things that kept coming up was that everybody's recovery journey is just that. It's personal. And how you come to this conversation is very personal. So I would like, if you wouldn't mind sharing with each of us what recovery means to you and why you're a part of this conversation. Nick, do you mind starting out for us?
I don't. Recovery is about life for me. Somebody put it really plainly for me, my friend Melissa, saying that when there's life, there's hope. And hope is super meaningful to me in my own life. I've lost quite a few people in my life. This has affected me quite personally over many, many years. In my mid-20s, I lost my grandmother to purposeful overdose, a suicide. She was the brightest light in every room, the most amazing person I ever knew, and then cancer changed everything. And she decided with her diminished quality of life, she didn't want to be with us anymore. And that really changed me fundamentally. Then into my 30s, lost friends to both suicide and overdose, started losing coworkers, people in the industry. So it really affected me personally. And I would say that the work that I do for prevention is rooted in loss, but continues to be inspired by the hope that there's so many lives that we can still save. And so what it means to me is really saving lives and being actively involved. And really that's all, at the end of the day, that's the biggest piece of the puzzle. So.
Awesome. Thank you. Dana, how about you?
Yeah, it's a big question, right? Recovery to me too means life. I have my chats with the universe every morning and know that I would not be where I am today had it not been for my recovery. And it means the world to me that I've been able to be in recovery for over 5 years and then also share that with other people and share the story, share the, I like to use the word adventure instead of journey. And you know me, I'm big on moxie. So, recovery to me is moxie. It's something that is internal. It's hardwired into you. You might lose it along the way, whether it's to substance use, to depression, to overwork, to whatever, but it's there. And to finally get that back and to be able to hold on to it and understand where it comes from is huge for me. So that is full on recovery for me and being able to help others find that adventure and that moxie as well.
Right. Thank you for sharing that. Cal.
As for myself, I love each of those definitions. Recovery really is about being authentic, and it's about being yourself and really learning to be comfortable in your own skin, warts and all. And for me, I hid behind a problem I had when I was a teenager with prescription use, misuse, and abuse. I learned not to judge others, but it took me many years to realize that I didn't have to judge myself as well. And so as I learned to embrace recovery, I became more comfortable recognizing that decisions I made were made for a reason. I shifted from physical pain to emotional pain. And when I judged myself harshly, I didn't allow myself to live that best life, despite being in a happy marriage and being a father of 5 children. I put so much emphasis on taking care of others, I didn't take care of myself the same way. And I made a decision a little over a year ago, 425 days today, to give up alcohol and to just free myself from that daily decision. Do I not? I just felt I could be liberated and free of that choice. And I'm grateful. And what I've learned over time is embracing this idea of recovery is where healing for me began. And I want others to know that that's a gift that's available to you as well.
Thank you, East, for sharing that vulnerably. I know that your openness is going to touch others that are listening to this. And if they need to, they will open up to finding their own recovery journey. So thank you again for doing that. Nick, I know that we don't like to talk about the numbers as much. This is a people conversation and it can be very personal, but would you mind just framing a little bit of a picture for us, specifically even in and around what you do in Colorado?
Yeah, I agree with your sentiment about it being a people conversation. I was just talking to someone on LinkedIn today. We did an overdose prevention fundraiser last night here in Colorado, and it obviously brought up a lot of conversations. And people were being very open about their own experience and the folks that they've lost, and really naming those folks and giving a face to the people that we're really talking about. So yeah, that is important, and we'll dive into that, I'm sure. I'll just paint a broad stroke for folks. A lot of people have gotten this information, but I just want to make sure we're all starting from the same place. For the past 3 years of data, we average about 70,000 people lost to synthetic opioid overdose. Construction, which I represent, obviously consistently leads all major sectors, and not just suicide, trading with mining, which we have a lot of the same risk factors, right? Trading with mining and suicide, but also, of course, in overdose, way up there in alcohol use, alcohol misuse, heavy alcohol use. Thank you, Cal, for mentioning that. That's a big part of our culture and part of our industry, and ultimately a risk factor in and of itself. So losing the number of folks that we lose to suicide and overdose is alarming, right? We talk about 70,000 as a number, and you think that that's an airliner of folks that fall out of the sky every single day in this country. I think a lot of the reasons that we don't have more of an uproar or societal response is there's often an attribution of a moral failing in that situation. And so I often use the numbers to really paint the picture as how many people we're talking about, individuals. And one of the best numbers that I like to assign and make sure folks understand, if we're talking about opioids, and we're not just talking about opioids, there's plenty of cocaine, methamphetamine, alcohol, marijuana use in our industry, amongst many other substances. But if we're talking about opioids, which is what's taking more lives than anything, we're talking about 92% of those synthetic fentanyl deaths were accidental. And when you think about an accidental death, use of another illicit substance that has fentanyl unaware to the person that was taking it, that's a poisoning. And as an industry, you need to treat it as a poisoning. And there's a very simple cure. And that's what we're raising funds for yesterday, which was the access and proliferation of Narcan in our industry. So yeah, we're losing a lot of people. The cure is known. We can definitely do a lot better as an industry. And I'm a huge advocate of recovery as a prevention tool. And I love what Cal said about being authentic, open, and honest. If our leaders simply understand that, man, we can combat this issue, we can combat these lives lost by being open, honest, creating an environment in which it's okay to be authentic, show up who we really are, and maybe raise our hand and say, I have an issue. I really like some help in starting this road to recovery. We could really affect positive change.
Thanks, Nick. Share that again about what you said about the airliner, because it sort of just slipped in the conversation, but the first time I heard you say it, it really struck me. So share that again, if you don't mind, that we lose.
Yeah, 70,000 lives lost. Now we had a reduction in the rates last year, but we didn't see that in construction. But thank God we saw it nationwide, and 70,000 lives in a year is an unbelievable amount of people. And when you break that down to every single day, that's 200 folks that we're losing, 200 souls. In Colorado, it looks like this. We're losing a person a day in Colorado construction every single day. So yesterday, today, tomorrow, every workday in construction, we're losing somebody. And when you break that down to the people and the folks that we're talking about, Sonia, like your conversation you just said, when you think about it in your mind right now, you think about your crews, those people, those are who we're losing every single day. And that really, I think, drives it home for folks.
Yeah, I mean, absolutely. And I think that analogy where you said that it's like an airliner full, if there was a plane crash, we'd be talking about this in such a different, profound way, because it's so singular in many cases, it's not as much of a conversation, right? Cal or Dana, do you want to add anything to that before we continue this conversation on a bigger scale?
I think what happens, Sonia, is people, to Nick's point, view this as a moral failing. They don't view this as this is me or us or we. It's someone else. And when we do personalize this conversation, we recognize many of us do know people we've lost. And I think finding a healthy way to communicate that is really important. I think that event that Colorado did, I probably had a big smile on my face. I love that state has so many associations that are actively engaged. I think that's going to go a long way in helping people. And so I just wanted to highlight those are the types of things that start to normalize and socialize these conversations. It's how we recognize and then celebrate that recovery is real and possible and all the other taglines that people associate with recovery. But it is a solution, as Nick described, and Narcan is an antidote for opioid overdose. We should have that available as a first aid resource in every workplace, every work site.
Do you want to talk a little bit about Narcan? I know we didn't rehearse that, but we've mentioned Narcan a couple of times. And so for anyone who's listening that doesn't maybe know what it is, do you just want to give a quick intro to what it is and why you should have it on your
and Nick and Dana are welcome to jump in as well. Narcan is the brand name for a product called naloxone hydrochloride. That's a generic name, and it is available as an over-the-counter medication since March of 2023. It has existed for a long time. It didn't become popular until about 2010. You started to see emergency medical services and law enforcement agencies as first responders carrying that. But until it became available as an approved over-the-counter medication, we had to go to every state and see what the naloxone accessibility laws were. We had to become very aware of the naloxone Good Samaritan statutes that applied. People still fear that there's liability associated with using it. Narcan is an inert object. It exists for one purpose, and that is to save someone's life by reversing the effects of opioids, which go on the brain's opioid receptors. And then that has the effect of shutting down some of the involuntary actions, including breathing. And so when you have naloxone available, you have it readily available for use, and you have people trained. It gives a person who has succumbed to an overdose the ability to be revived. And powerfully, it won't have an adverse impact on people if it's not an overdose. And you still call 911 for that emergency medical response to initiate first responder care. Nick, Dana, anything else you want to add? I tried to give a high-level overview.
Yeah, so I'm indirectly in the construction industry, but me personally, I carry it with me all the time. Every time I go out, it is in my backpack. So it is something that I feel is super important and always on the ready in case, somebody needs me or something happens that, just the unexpected.
Absolutely.
When the rates reduced year over year and the CDC published their report and said that the number one reason we saw rates reduced was access to Narcan in industries like, law enforcement, food services and accommodation, healthcare, saw rates go down in all those places. Well, they thought, well, what's the one thing that makes that different? And they have tons of Narcan available. So just like we said, where there's life, there's hope for recovery. Preventing accidental deaths is a huge deal. And we saw the rates of death reduced in this country simply by having more Narcan and naloxone available. So to me, the solution seemed really clear for construction. We have almost no early adopters. There's a few brave souls that are doing this work here as far as general contractors and subcontractors are concerned in Colorado, but only very few. And so the goal of the upcoming Health and Safety Summit is going to be to not only proliferate naloxone into the industry, but educate folks about what we're dealing with as an epidemic and some potential solutions for a recovery-friendly workplace. So yeah, we're really excited about hoping to have a positive effect on saving lives directly.
So I am lucky enough to get to go on job sites all around the country. And I will say that more and more, and I send Cal pictures all the time, but I get to see the "We Have Narcan Here" sticker that they have. And so it's certainly, it's something we talk about as part of that intersection in the conversation, but more and more I am starting to see it and see some of those early adopters and people saying this is an easy way to be part of change and to save people's lives. So switching gears a little bit to, as I got to say, all around the country. And so that national conversation, then Dana, you mentioned earlier being part of the recovery friendly workplaces, the national side of the conversation. Can you tell us a little bit about that and what's happening from a national perspective, if you don't mind?
Yeah, sure. So the Recovery Friendly Workplace Institute is a nonprofit organization that is certified. They set up a certification process for companies to go through a process to get certified as a recovery friendly workplace. It's an in-depth certification program. We have 21 companies that have been in our first class, and we have about 4 to 5 companies a month coming, and we are reviewing and getting them on board to being certified. The process is interesting. It makes companies really think of what they already have and what they need to be putting in place to become recovery friendly. and it's been an interesting process, even for myself, with Oracle being as big as it is, the process I had to go through for it as well. And we can talk about that in a little bit, but I know we weren't trying to talk about numbers and things like that, but the need for recovery-friendly workplaces is so big and strong at this point. You know, I have a couple of numbers that I just want to throw out. There's 14 million US employees that are in long-term recovery. And to have a place that you feel safe to work at is super important. You know, you have that support there, you have benefits that will help you stay in recovery and have those resources that you need. 26.9 million employees do have a substance use disorder, and that is as of 2021. I think those numbers kind of fluctuate as they go up and down every year. 2/3 of US households have somebody who is affected by substance use, and substance use costs employees, this number just blows my mind, $81 billion annually. And that's not just for people that have the substance use, right? It's people that have presenteeism. It's that mother that comes into work and sits at her desk and is at work, but spends 5 hours trying to figure out what benefits she has, trying to figure out what treatment centers are available for their children to get help. It encompasses so much more than just the person. And that's why I feel such a need to be part of this work. And it all stemmed from, you know, just starting something grassroots at Oracle. What's really cool is that, well, not really cool, but there's only 13 states left that aren't engaged with some sort of recovery-friendly workplace work that they're doing. I know some people are just at the beginning stages. Yeah. There are some states that are, you know, right at the beginning and the cusp of trying to figure it out. And then there's others that are super entrenched in it already. They have whole state programs that are already certified and have programs in place. And we had a conference in DC a couple of weeks ago where 57 companies came together and talked about recovery-friendly workplaces. Unfortunately, the last minute, I was not able to make that conference, and I had a severe FOMO event about it, so fear of missing out with everything that they talked about. There were 6 sessions held. Findings from the field, state models for designation and certification, health plan legal landscape, which is beyond compliance, and SUD mental health parity, employer experiences and feedback on the certification process, hiring, retention, and return to work, and philanthropy landscape to support recovery. So this will be out on YouTube to actually view some of these recordings. So I'm looking forward to doing that myself, so I can immerse myself on all the happenings that went on. But it continues to grow. We continue to work with some of the departments at the White House. It is, you know, not a political thing. It goes both parties, both ways, both streets, everywhere in between. And it affects so many people that we are at the national level at this point.
Amazing. What does it really mean to be a recovery-friendly workplace, though?
So I'll read you the definition from the Institute.
Okay.
It is a place of work in which the employer, in collaboration with employees, establishes, maintains, continually enhances policies, practices, and a culture and work environment that are supportive of current and prospective employees in recovery from or otherwise affected by substance use disorders.
Okay. So Cal and Nick,
Cal has something.
Yeah, I was going to say, I want to hear more from you two on that as well.
Yeah, Dana, thank you. And Nick, I'll save Colorado Recovery Friendly Workplace for you because you're right there. But that's an area that I've been very excited about and use that resource a lot. The first Recovery Friendly Workplace initiative began in the state of New Hampshire in 2018. And they're kind of the OG. There's still a lot of organizations that don't understand what this idea of recovery-friendly workplace is. And one thing our panel did talk about in our one prep call was it has different names. And so it's also been referred to as recovery ready workplace. And then there's
Yes.
another word that's been workplace supported recovery. And so we wanted to share that evolution with people. It started as recovery friendly. The federal government adopted that title, recovery ready, when they put their hub and toolkit together on their website. And now recovery friendly definitely seems to be more commonly accepted by workplaces. And many of the state initiatives appear to be adopting the recovery friendly framework more than that recovery ready framework. And then total worker health from NIOSH, National Institute of Occupational Safety and Health, talked about workplace supported recovery. Fundamentally, the three of us agreed that each of those titles refers to the same thing: creating a culture and a climate in a workplace to support individuals with substance use disorder, to break down stigma, to provide education and training and resources to help workers and their families embrace this idea of recovery. So that was one clarifying point I thought I could offer. And then Nick, if you want to talk about Colorado and your work with David Shapiro, that would be awesome. I think people would love to hear that.
Yeah, we're really lucky in Colorado. We have School of Public Health. We have one of the Centers for Health, Work, and Environment. And I think it's no surprise that the New Hampshire Centers for Health, Work, and Environment and the work that the Colorado one was doing, I think that that's really where a lot of our recovery-friendly workplace practices came from. I had the pleasure of testifying in favor of Senate Bill 48 that passed a couple years ago here in Colorado and created the Recovery-Friendly Workplace Colorado funded website and training tool to really help folks understand what it means to be a recovery-friendly workplace, because it's not easy. It's not black and white. It's nuanced and difficult, and because people are nuanced and difficult. And the great thing is we have these resources, this entire team of people that are really, really ready and willing to help. What does recovery-friendly workplace really mean to me? As a former director of operations, managing a team of anywhere from 50 to 75 people, it was about, well, initially it was about failure. I really didn't do a very good job. And I think that that's an important message for folks to know is, if you're starting this or you're inquisitive or curious about what could happen at your own organization as it relates to recovery-friendly workplace, really there's the opportunity for you to grow and learn, lean on your network of folks that can really help, because that's what I had to do initially. I had no idea what I was doing. Ultimately, at the base of everything, the concept was clear, and the data suggests, the research scientists have published all the papers. The number one thing that can help somebody on their road to recovery is the accountability that a workplace provides. The workplace is a huge part of recovery for individuals. So that means we, as a workplace, have a responsibility to meet folks where they're at and accompany them along that road to recovery. That does not mean charting it for them, doing it for them. And I think that's an important delineation to make for employers and for folks who run businesses to understand. I do consulting as it relates to recovery-friendly workplace, and I talk to business owners all the time. And the number one thing they ask me is like, how am I supposed to do this and not make it okay that folks are using substances on the clock? And I said, it never is, and it never will be. That's not the point. The point is that you're going down, starting a road to recovery with these folks, offering them the support systems to be able to actually start that journey. And you're telling them, if you try, we'll try with you. And that's really what the employer can do in a way that no other support system in that person's life can, is provide a true piece of accountability in their life to walk that road of recovery successfully.
That's awesome. Thank you. So Dana, you've done that in a very large company, has started having these conversations and breaking down those barriers. I think Cal and Nick both talked about failure being part of this, or personal feelings of personal failure. And that's why there's so much stigma around this conversation. How do we break down the stigma and create allies and advocates in the workplace?
Yeah, what Cal said earlier about authenticity and just being yourself. Um, One of my general managers that I'm very close with, one of his sayings is being comfortable, being uncomfortable. And it is so very true, because if you're not, you're never going to break out of that and grow. So that's what I decided to do. I was like, you know what? I am not the only one that is going through this in this huge company. I have an overwhelming need to support my fellow employees. What can I do? And I reached out to him and I told him my story. He was shocked. I apparently hid it well. um, but he was very welcoming, very supportive. Um, and that's what I needed. I needed somebody to support that and to say it's okay, and he really lifted me up. I really had a strong person, an advocate in my corner. Now, what to do with that information was we went from person to person to department to department, right? It was like I wanted to bring coaching into Oracle. I wanted to bring recovery coaching, something that would make a difference, that could go along with somebody's recovery, once they came out of treatment, and help them through, getting back into the workforce, getting back into their position, and moving forward with their career. Great idea, Dana. This is great. How do we do this? I'm like, I'm coming to you to figure that out. Well, what if somebody takes your words and does the unthinkable and takes their life, or does something to harm themselves? And I'm like, well, first off, I'm not a therapist. Second of all, I'm not giving any advice on, those types of things. So that was a very touchy thing 5 years ago, right? But they all loved the idea, and it was like, well, maybe you should talk to HR. Go to HR. Maybe you should talk to benefits. Go to benefits. Well, we really love it, but we don't know what to do with it. So I was like, fine, I'm good. We have employee resource groups. We have affinity groups. I started my own group. I just started a grassroots Slack channel, Reclaim Your Moxie. Let's go and figure this out, right? And from 2021 to now, we have just shy of 400 people in the group. We've got, just shy of 50 people in the Oracle Alliance Recovery Group that came out of the Reclaim Your Moxie. We have engaging sessions every week where we talk about, anything from mental health and well-being to actual activities and subject areas. We've had webinars for resources on recovery and treatment centers and how to find them in your local communities. I'm lucky enough to have Oracle Health, which used to be Cerner, and partner with them. And so it's been this grassroots growth of recovery friendly. And the more that people kind of hear about it, the more people come out of the woodwork and ask, how can I help? How can I be part of this? I had somebody yesterday said, I've been in your channel for 4 years. I have not posted once, but I want to know what I can do to help. I'm studying to be a peer support specialist in my area now. I've been sober for 28 years. I go to AA, but I know there's more. Those are the conversations that keep me going here at Oracle with this stuff, because sometimes it does get a little overwhelming and you're like, what am I doing this for? But it's that kind of stuff that I'm doing this for. It's this kind of stuff that I'm doing this for. And I've created allies and advocates at the highest level, executive vice presidents of government affairs, who, works with the Pentagon and the White House on the daily. I've created, those allies in US benefits, where we have found benefits that we didn't even know we had, that are now openly available to our people, so they understand what treatment centers they can go to that are pre-approved, that get paid, their leave of absence gets paid, and that they get to come back to a job. So it's been quite the adventure the past 5 years of just a grassroots growth of peer support and being part of something bigger. So
what advice would you give to somebody who wanted to start doing this in their own company? Where would you tell them to start? How do you create that first ally?
I went to my manager. I went to my first line manager first, and we talked about a plan. You know, like, where's this coming from? How do we do this? What does it look like? And just start the creative juices, start understanding how you can help others, even if it's on the tiniest level, right? And then see where that conversation goes. You have to make sure that management's on board. You know, that there's that empathetic bit there and compassion, which I'm finding we have a lot of. And I was surprised, and you know, in a big corporate company, but there, you know, we're all just real life people here, and when you get down to it, they care, and they care about their people. So I would go to your first line manager, and then, you know, depending how big or small your company is, that's when you talk to benefits. That's when you talk to leadership. You talk to people who can make a difference and take that next step to help you form some sort of support group, or look into certification, look into getting Narcan on the job site or into the office.
So Nick, I'm going to throw this question to you next. And Dana just talked about this on a large global sized company. How do you have that conversation and get those allies built and that destigmatization happening on a more localized company level without the fear of feeling like, because we're maybe smaller and know each other more, that people will now look at me like I have a problem and that I'm not part of the solution?
Yeah, I mean, that's a great question. You know, Subcontractors Association, we have 100 members, you know, subs of all sizes, right? So anywhere from 5 to 150 employees. And then we have some GC members that have hundreds and hundreds of employees. All those different sizes have one thing in common, and that is that addiction and substance misuse does not discriminate. It affects every single part of the industry, every single level of the industry. I know a lot of business owners that really ask me the question, is this mostly an hourly problem? No, it's not. It's a tough pill to swallow, because quite often when we're having these discussions and I'm talking with leaders, I have to ask them if they're prepared to take on recovery-friendly workplace, them individually, them and their family, right? And oftentimes that's a tough situation or a tough conversation to have. I would say the number one tool that I utilize is the National Safety Council has an amazing substance use calculator on their website. You can plug your company in, you can plug your state in and your industry, and it tells you how much you're spending on replacement of employees. If you're not treating them in a recovery-friendly manner, it also tells you how many folks are struggling with substance use inside of your own organization right now as we speak.
Wow.
I'll speak from experience. I, as a director of operations and a safety manager, we had 0 people at my organization that had a substance use disorder before we became recovery friendly. And wouldn't you know it, after we were recovery friendly, we had about a dozen recovery journeys that happened. The only thing that changed was our approach. They were always there. They just needed somebody to be there with them. And I would say that for any organization that wants to take that road on, just acknowledging and understanding that for certain, there are people in your organization right now that are suffering from substance misuse or substance use disorder. It is a certainty. It is not, you do not need to wonder. It is there. And so owning that, understanding that, and then deciding what you're going to do with that information is really the next step.
Mm-hmm. Thank you. So Cal, we've touched on this conversation a little bit and on what the policy looks like around this, because you hear a lot of conversation about things like last chance agreement, second chance agreement, additional chance agreements. But Dana talked about creating a space where people know that if they come forward, and Nick touched on it as well, to say, I've got a problem. How do you do that and protect someone's space and place within the company as well?
It's been really hard, Sonia, and yet we've done it in suicide prevention. We've said we need flexible, adaptable policies, but this has to be a cultural imperative more than a policy and procedure to follow. So I think to Nick's point, and to Dana's as well. What's powerful here is recognizing this is generally a latent existing issue. We have to acknowledge that it's more likely than not to be real. What I find, like Nick, when we do consulting with individuals, we have to ask a lot of questions. We do a gap analysis. There's a lack of curiosity about what's in our benefit programs. Does an employee assistance program help? And I shared this morning on a different panel I was communicating with. It was HR professionals. And I threw the gauntlet out to say very few organizations have a vetted list of resources that are community-based. City health, county health departments, recovery organizations, and then even private consulting groups and nonprofits, social service agencies as well. We need to develop that curiosity to say, what if this problem is there and we don't know it? How does that impact our workforce? What does it do for our retention? What does it do for our engagement? What does our absenteeism and tardiness look like? What does presenteeism look like in our organization? And then agree to have a leadership conversation. So the best policies that I've seen aren't perfect written. They're flexible and adaptable. It is about meeting people where they're at. Both Nick and Dana use that phrase. It's a phrase we use a lot at Safe Project. What I would say today, I know some organizations don't necessarily fully understand the Family Medical Leave Act, and they don't fully understand the provisions of the ADA. Having a leadership conference in your organization to teach managers and supervisors the fundamentals of recovery, talk about addiction as a chronic health condition is a great starting point. Put the human touch, talk about what this is for individuals, and then what barriers exist to people seeking help. If all we have is a last chance agreement and a person has already used that first step, are they likely to come forward and ask for help? And if they do we help them? Do we roll up our sleeves and offer them guidance? Too often we hand a referral number. Here's the EAP, call them. We sometimes mistake this idea of privacy and confidentiality with absolute certainty. I found it worked well if I offered support to people and then kept confidential anything someone described. So I tried to give you a few pathways we hadn't talked about. And I think it's really important to look at this as cultural and then recognize the need is there, as Nick said. And then how do we build the support like Dana did with her employee benefits? That's often a missing link. And I think to Nick's point, they had an EAP, but people weren't using it because they didn't know it was safe to use it. So those are some of the themes that we could probably explore subsequently. Maybe we'll get them in Q&A.
If only we had hours upon hours, right? I was just looking at the time and thinking, gosh, we only have 13 minutes and I have 100 more things we could talk about, but I will try to restrain myself. One of the things that I wanted to mention off of what you said, Cal, is that when talking about cultures of care and talking about people who live cultures of care on a regular basis and looking at their policies, a lot of them say, it's not what you have to add into your policies. It's what you might have to take out of your policies that are already there to create those spaces and places for people to come forward and say, I'm struggling, whether it's with substance use or their mental health or the intersection of the two, and be able to be comfortable and feel like they're capable of saying, I need to get this help and have a space to come back to. So that's something to keep in mind. So we are, as I said, getting close to time. So I do want to ask you each for some final thoughts. And as you're giving me your final thoughts, you are welcome to also share some of your favorite resources in this conversation as well. So Cal, since we've ended with you multiple times, I'm going to start with you this time.
Oh, that's nice. Thank you, Sonia. I think I like to highlight stories of hope. And I did that recently in a National Safety Council co-sponsored webinar on the naloxone topic. So that to me has been a really easier conversation. There are many companies taking leadership in that space. I did notice today we have representatives from different associations that have had conversations about recovery and recovery-friendly workplaces. So I want to highlight that. One example that very few people are aware of started in 2019 in New England, and it was called Building Trades Recovery Week. I have a vision that someday, much like we do Suicide Prevention Awareness Week, that we will celebrate Recovery Week across our industry. So I wanted people to look up Building Trades Recovery Week. We'll send some conversations with your show notes to some of these resources, but the Building Trades Employers Association in Boston and the Massachusetts Building Trades Association have partnered on this initiative since 2019, continued during the pandemic, and we've seen radical changes occurring. The only other highlight that I want to give would be look at what's happening with peer support programs. And that's going to be something, Sonia, you'll probably want to do a separate webinar, and I'll be happy to connect you to leaders in that space.
Absolutely. Real quickly, tell us some of your favorite resources that
So
anyone can
favorite,
go to.
yeah, so the one Nick talked about, frequently I have to use that National Safety Council Substance Use Cost Calculator. At Safe Project, we have a no shame pledge to reduce stigma in organizations. It talks about addiction and substance use as a chronic health condition. I like to use a book called Recovery Allies by an author named Allison Webb Jones. That's a very powerful book. I use the Colorado Recovery Friendly Workplace book often because I find it to be very practical. It's broken down into step-by-step implementable resources. There are so many, but those would be representative examples of tools and resources.
I also often refer people to Safe Project's naloxone videos on how to administer naloxone so that they feel a little bit more comfortable with it as well.
Thank you for that.
Let's go to Dana next. Tell us final thoughts and then favorite resources, please.
Yeah, final thoughts. You know, thinking back to several other conversations that we've had over the couple of years, you know, the success stories that come out of these types of things. Even with my just little homegrown, you know, grassroots programs here at Oracle, you know, I've been in touch with so many different people that I would never have gotten to know had it not been for these programs in place. I've had people reach out to me for resources for their family members, but how to get in touch with benefits. How do I tell my manager? I have a severe drinking problem. I'm afraid to lose my job, you know, and all of these people, I need to grow this out so I'm not the only person, right? But to have these people reach out to me and trust me with their information and know that they have a safe person to at least open a dialogue with makes my soul just soar. And to see how they take that next step and how they get themselves in treatment or how they are able to find the resources that they need, you know, in their community for their family members, has just been a wonderful experience and growth experience for me, both professionally and personally with Oracle. The Oracle Alliance Recovery wouldn't exist if it wasn't for me doing a facilitator program during May 4 years ago and educating people on substance use. And all of a sudden I had 5 people be like, I've been in AA for 28 years. I've been going to 4 meetings a day for 32 years. And they've all of a sudden were just comfortable talking about it. And that's what this is all about for me, is making space in a corporate atmosphere comfortable and safe to get themselves well. And you know, you, Sonia, you're the CIASP. That is a huge resource that I give out a lot. Safe Project, of course. And for me personally, I know this is going to sound crazy, but quit lit. So all of the books that are written by folks with their own recovery journeys really made a difference in my recovery journey adventure at the very beginning. It gave me hope. It gave me promise that, man, some of these people, their relative rock bottom was way worse than mine, because I wasn't sleeping on a jail cell floor or, homeless or things like that. So I was like, all right, if these people can do it, I could do it, right? And so I think that Quit Lit and other people's stories really are good resources to get you on that path.
Awesome. Nick, final thoughts and favorite resources.
Yeah, I want to piggyback on what Cal said about what this looks like to actually get implemented if you want to be recovery friendly. I'll tell you this, the one thing that changed at the previous organization and what I've seen happen at other organizations that I work with, the systems, the protocol, the paperwork, that's not what drives this change. What drives the change, what drives folks to enter into a world of recovery, to change their lives, to fundamentally transform who they are, isn't paperwork. It's not a policy. What it is leaders being really vulnerable. And that's what I've seen every single time. When leaders of an organization stand up in front of the room and say, hey, this is what I'm struggling with, and this is how I've used our resources. Not only does that provide a clear through line to how to actually utilize the resources and how to find them, but it says it's okay to struggle. It's okay to not be okay. And it's okay to actually need some help. And once a leader is able to do that, it changes the culture of the entire organization fundamentally. So that's what I tell leaders every single day. If you're ready to actually do this and do this in front of everyone and be vulnerable about what you're dealing with, then folks will be more honest about what they're dealing with. And then, like Cal said, you have one success story that turns into 3, 7, 12, because the people know that they can trust your organization because they saw somebody successfully navigate that recovery-friendly workplace practice. So it only grows from there. My favorite resources are you guys. My life fundamentally transformed when I took the stand, when I stood up for suicide prevention. Thank you guys for everything you've ever done at CIASP. My life changed again when I took the No Shame Pledge. What Safe Project does for us as an organization, as an industry, is provide a template for meeting people where they're at, not making them feel even worse about what they're struggling with, and then growing from there and going on the journey with them. So I wear these bracelets every day of my life because I want people to know the people that have changed my life and how they can help change theirs.
Incredible. Thank you. You can find us at preventconstructionsuicide.com. I am going to open up the Q&A. We do have a question here. It says, when I entered recovery over 28 years continuously sober, so congratulations for that. Someone said, you can lead a horse to water, but you cannot make them drink. I've experienced employees that have tried to get help through treatment who did not choose to drink, and we eventually had to terminate. Recovery has told me that you should never shield an alcoholic or addict from the consequences of their actions, but many employees conflate assistance with enabling. How do each of you feel about the line for when a good company, you have to set boundaries and terminate someone who consequently chooses suicide over recovery, or who chooses to continue to act? Thoughts on that?
Jump in first. I think this is a really tough part of this conversation. We had that conversation when we first talked about suicide prevention, that despite our best efforts, some individuals may die by suicide, and for very many reasons. And we need to kind of apply that same logic. We need to move this conversation upstream to help people before they lose their recovery capital, the things that keep them fully engaged in life and healthy relationships and a solid job with benefits and meaning and purpose at life. So over time, I've seen sadness on both sides. I think Nick described it well. We're giving people boundaries. We're giving them a framework for success. We're meeting individuals where they're at. We're offering them support. We're offering them the opportunity to seek help. We're providing pathways to recovery, and not just one pathway, but multiple pathways of help and support. We didn't talk about that today. If we can offer them that peer support framework, if we can offer alternatives to alcohol at company-sponsored events, make it more inclusive, more belonging, we're starting to take down some of the barriers, some of the gaps, some of the things that create obstacles to people pursuing recovery. I think it does come down to access to care, and there's nothing fundamentally wrong with accountability. I tell people all the time, Nick said, doesn't mean that we're being permissive with substance use on site. It's giving people an opportunity. I'll tell you one thing that really encouraged me. I want to just highlight this fast, but I know an organization that works with really tight zero tolerance owners who set really strict policies. And that organization said, as long as a person is willing to get well, we're going to stand by them. And they found a way to do that. And they gave an individual 6 chances. They supported that person. They didn't terminate them and kick them to the curb. So that's a loaded question. I tried to give you multiple pathways, but I think fundamentally, each of us did talk about the need for that accountability as well, and give people an opportunity to have support for that recovery journey.
Thank you. And thank you all for being here. We are at time. Thank you, panelists, for all that you are doing in this conversation and in this space. You truly are saving lives. And thank you for everyone who joined us today. You can find our resources at preventconstructionsuicide.com. You can go to Safe Project as well to find resources, Recovery Friendly Colorado, and the National Recovery Friendly Workplaces. And there are many, many more. So take care, everyone, and be safe. Thanks again.
Bye.